Canadian Animal Health Surveillance System, we're hosting this webinar today. And so Canadian Animal Health Surveillance System is a division of Animal Health Canada, which was called until about a month ago National Farmed Animal Health and Welfare Council. But saying that, within the Farmed Animal Health and Welfare Council, there certainly is the mandate within our CAS to look at companion animals. And we've really been focusing on that a little bit over the last 6 months or so in building that. So you can see on this slide that we're not the only division or project within Animal Health Canada. There is also the National Farmed Animal Care Council, Animal Health Emergency Management Project, and African Swine Fever Project, and the Canadian Livestock Transport Program. And so the Canadian Animal Health Surveillance System, our purpose is to promote animal health surveillance and coordination across Canada in all aspects of animal health surveillance. And we work closely with the regional animal health surveillance networks across Canada, which include ATCAN, or the Atlantic Canadian Animal Health Network in the Atlantic provinces, Réseau in Quebec, OWAN, or the Ontario Animal Health Network in Ontario, and WECAN, or the Western Canadian Animal Health Network across the Western provinces. And I think we have most of the regional network coordinators or representatives on the call today. So if you're able to, just turn your camera on and wave at everybody if you're here today. I'm putting you on the spot. I didn't prepare you for this at all. All right. And then we also work closely with representatives from the animal and agri-food industry sectors in federal, provincial, and territorial government, as well as with our animal health laboratories, our public health laboratories, and the universities, particularly the veterinary schools and also some of the agriculture schools. And we do work with the Canadian Wildlife Health Cooperative on issues at the interface of wildlife and domestic animal health. So this is just a slide that shows some of our partners, and I'll just give everyone a moment to have a look at this. These are really some of the main organizations across Canada that are active in animal health surveillance, and I'm sure you're familiar with many of them. So the Canadian Animal Health Surveillance System itself is designed of a network of networks. And our networks are really our fundamental components. So we have beef, poultry, small ruminant, dairy, aquatic, antimicrobial use and resistance, equine, vector-borne disease, and finfish networks. And now we have a companion animal health network. I think it started about 6 months ago. It's one of our newest networks, and this is an initiative to build on the work that it's doing. We also work with the Canadian Swine Health Information Network, CSIN, with regards to swine surveillance. And then we have a smallholder working group that looks at the smallholder sector, so mainly pigs and poultry on the smallholder side. So each network brings stakeholders together every quarter to discuss animal health, identify surveillance priorities, and plan surveillance activities. And all of the networks are a little bit different, but they can include representation from agriculture or animal organizations, the veterinary sector, federal, provincial, and territorial governments, our laboratories, and universities. And then I just wanted to point out a couple of CAS tools or products that we have available. And the first is our website, which you can find at www.cahss.ca. And it's a centralized information hub that we launched about a year and a half ago, and we've been continuing to build. And there's quite a few resources on there that would be valuable to companion animal practitioners, veterinary students, etc. And they're available in both English and French. So we have a resources library, we have a surveillance initiatives library, so who's doing what in terms of surveillance across Canada. And if you have an initiative that you'd like added, there is a form that you can fill out and we will add that surveillance initiative. We also have a disease alerts page, which is mainly used by our equine sector in posting disease alerts so that information is available across Canada. And then we have a regulated disease table that talks about which diseases are regulated federally and then within each province and territory across Canada. So it's an easy searchable tool. The other initiative I wanted to point out is our podcast series. So we've been producing an online podcast series called Animal Health Insights, and the podcasts are about 30 minutes long. And we currently have 9 episodes available for download or for live streaming. And we've had about 300 episode downloads so far. And I just wanted to point out this one might be of particular interest to the companion animal stakeholders, and that's about importing dogs, importing diseases. So episode 9. And finally, just wanted to quickly point out our CAS social media tools. So our website, our Podbean, where you can find the Animal Health Insights podcast, and our Twitter feed. And then we do have LinkedIn also. If you would like to join CAS, you can visit our website and there's a join us, or if you want more information, you can email us also, either Doris or myself. And then I just wanted to point out that funding for all of our activities, including this webinar, is provided through the Canadian Agricultural Partnership, a federal, provincial, territorial initiative. And we're very thankful for that funding because it allows us to deliver a lot of great surveillance products. So that's all I have, Doris. So I think now, Tasha, are you there and ready to be introduced?
Yep, I'm here, Teresa.
Oh, great. So I'll just go ahead and introduce Dr. Tasha Epp. We're very delighted that she is interested in presenting the information that she's going to share today. Dr. Tasha Epp received her DVM at the Western College of Veterinary Medicine and her PhD at the University of Saskatchewan. She is currently the Associate Professor in the Department of Large Animal Clinical Sciences at WCVM. Dr. Epp's research interests are on the epidemiology of zoonotic diseases of companion animals and on disease surveillance. And she is currently leading the Companion Animal Surveillance Initiative, otherwise known as CASI, which I think, Tasha, you're going to provide us a lot more information about CASI in your webinar today.
Yes. Yep.
All right, take it away. Thank you for being here.
All right. Just share if I can get this to work. Okay. So yeah, we're going to talk a lot about surveillance today and sort of its importance from a companion animal practitioner perspective, because we hear a lot about it, perhaps on the large animal side or livestock species, but maybe less so from a companion animal perspective. And just before we started, I wanted to sort of extend my prayers to the people of Ukraine and their present crisis, as well, particularly the 4 families of the animal health workers in the Ukraine that were recently killed. And so just sort of on the thoughts and minds as we're dealing with sort of a world in crisis. But if we go back to the idea of surveillance, probably sort of the first thing that comes to mind for most people is, what is that exactly? And so a good place to start is just thinking about, you know, a most comprehensive definition, or even get down to being more specific, what is the most simplest definition? And I really like the bottom one, which talks about information for action. Because essentially, if we think about what surveillance is, that's what our intention is. We want to have information that then we can do something with that. And that's sort of the whole focus of why we do it and how we do it. But if we want to get a little more specific about surveillance, it really deals with ongoing systematic collection, then the analysis, interpretation, and dissemination of that information to individuals that are going to be important for planning, implementing, or evaluating some sort of health action that is a result of that information. And all of that is really important. But really the biggest piece, I think, to kind of understand what surveillance is the idea of the ongoing and systematic collection. Because that really does differentiate us from other pieces that people might be more familiar with, which is research. And so, you know, when I'm talking to students about what is surveillance, one of the things that I like to put forward is that there is a distinction between what surveillance is and what research is. And so we kind of have to keep that in mind. Research, which most veterinarians should have had some exposure to research, either in their training or being asked to be part of a project, is the idea that it's some sort of observational or experimental study design that sometimes describes a population, but more often it's trying to test a hypothesis, figure out why or how a particular disease is existing within a population. What are the risk factors? And so research can be quite defined in a period of time. It's not often something that goes for long periods of time, although it can be, months to years, depends on what you're looking at. But it's often very, very detailed in what is it we're trying to answer specifically. So the data can be complex, the process can be complex, but there's a set purpose and an end goal of what we're trying to get to. On the health surveillance side, if you think about it more, that it's very descriptive. We are looking at gathering information that allows us then to lead to some sort of actionable item. So it might be collecting information, and when we hit a certain threshold of maybe a certain number of cases or events, that we do something about it. So surveillance is very long-term in duration. It can be detailed in terms of the number of things that we might be collecting information on, but it's not generally detailed in what we collect. And so it's this balancing act, being able to do something long-term sustainably. And to do that, we can't ask a lot of detailed information often. We're getting sort of a sense of what's happening, and we can look at trends over time. And so it is important to see those distinctions, because often, the downfall of a surveillance program is thinking it can do too much. And so confusing it with research will often lead someone to try to gather too much information that they're not going to actually use in the essence of doing anything about it. And so if you're collecting for the sake of collecting, then it's not really surveillance. And so that's, an important distinction to be able to make that and understand how that influences what you collect and how you collect it. So focusing on the idea of surveillance, we want to be able to see, is there trends over time? Are things increasing in the number of times it happens? Are they decreasing? Is it remaining stable? That's often what you'll get from good surveillance research. So some examples that have already been highlighted in sort of the initial, what does CAS do, and what are all the pieces that play into. CFIA has terrestrial disease surveillance activities and aquatic disease surveillance activities. So we have disease surveillance, but there's also other elements. You may have an idea of, what's the other number of animals being imported, exported? What are the biologicals, what vaccines are coming in, how often, what's being licensed, what are the safety concerns about those? All of those can be pieces of surveillance information. So surveillance in animal health isn't directed specifically just towards disease. It can be towards other pieces of information we need to understand why we have these diseases even, right? Where are animals being imported from can give us an indication of what we might have as risks for disease introduction. So it all plays a part in the idea of surveillance. And you will notice on the list of terrestrial diseases listed, rabies is on that list. It is one of the pathogens that is collected from a companion animal perspective. Although if you were to look at a lot of the other ones, you would note that the livestock population of our country is probably a stronger focus for many of our surveillance activities to date. So why do we do surveillance? Again, this comes right back to that, what is surveillance? It's information for action. So the first thing would be that we need to identify health events, disease outbreaks. We might need to know, are they in particular groups, geographies, particular time zones, because we want to do something. And so that maybe we want to target specific interventions to those diseases, right? So we need to be able to know what is there, so we're able to respond to it in some manner. And that may be an immediate response, or it might be, on the other end, more of a long-term thinking to create evidence-based policies or programs. So the idea of prevention or control. And then sort of at the bottom in the smaller letters, right, we always have international obligations. And so we have both those on the human and the animal health side, that although what we collect here in Canada may be specific for us, some of it will need to also be reported in terms of meeting our international obligations. So again, it really comes down to that purpose. Surveillance is information for an action. So a really cool example that's come up in the last number of years would be the dilated cardiomyopathy outbreak. This was found through a system of surveillance and has resulted in some research projects, has resulted in sort of further work from a surveillance perspective to try to figure out and learn what we need to do in order to respond to this. So if you look at the graph, it talks about the dilated cardiomyopathy reports to the FDA, which is through a process, which I'll show on the next slide. But they were getting some sporadic reports sort of between 2014 and 2017. But it really started to increase in that 2018 year. They probably had about 150 or so reports up to about the end of June, at which point they decided, the FDA put out a media release so that it was much more widely recognized throughout the veterinary community as well as the animal health owners community that this was potentially an issue and that there was a reporting mechanism available. So if people didn't know about it, it certainly resulted in a lot more being reported after that. Up through, and so this graph only goes to 2019, but it's certainly been ongoing since that time period. So how does this actually, sort of what is the surveillance? So on this next slide, it sort of gives you a picture of what the system is and how it's set up. So this is specifically in the US. If there's a sick animal that's suspected of having an illness due to a food or drug, that can be submitted as a complaint through the online reporting system. This is a reporting system that is both for animal and human, in which there is suspect of some kind of food or drug component to that illness. Once these things are reported, then there is 3 possible actions that are taken. One is they monitor for more complaints. One is they decide that they need to gather more information where they can start an investigation arm, which is sort of the bottom half of this graph, where they do some active data collection. So the top half is more of a passive surveillance, if you've heard of that terminology, and the bottom is a little bit more of an active participation in gaining more information. And then in the end, again, if it conclusively comes to a final conclusion that the food or the drug was an issue, there can be regulatory action. If it's still inconclusive or unknown, it can result in more monitoring or more investigation. But this is the process of collecting information for some sort of action in the end, which again defines a surveillance system. In Canada, the only sort of equivalent that I could find was the Canadian Food Inspection Agency has a where to report a complaint. It's a little bit more driven by human than animal concerns, but certainly is a similar sort of mechanism. So how do we do surveillance? There's certainly multiple ways to look at this, how we do it, the methods. And one of those is to look at where the data comes from. So on the human health side, these categories are similar. On the animal health side, we might sort of do them in slightly different ways, but they have similar uses. So administrative data, Certainly on the human health side, we have a lot more, like there's vital statistics of who dies, who lives, who's born, all that kind of stuff. On the agricultural side, Stats Canada through the agricultural census is a great way of providing us information on livestock populations. How many of those are sort of increasing in number, how many are decreasing, where they exist across Canada from a geographical perspective. That doesn't actually also include companion animals since it is an agricultural census. But we have the Canadian Animal Health Institute, which does a population pet survey approximately every 2 years. Their most recent one was done for the 2020 year, and it was just released last February of 2021. So the website there listed is if you want to go and look at that particular one or see any of the archived ones. And so you'll get a sense of what's the population of dogs or cats in Canada, and is that increasing or decreasing from past years? Certainly a source of information about our population. Health surveys, again, different from research in that these might be those types of surveys that are done periodically, but consistently with the same types of questions, just done maybe on a 2-year or every 5-year basis. An example would be the CVMA's Pet Wellness Report that, again, you can find on their website. Just getting a sense of the health of our dog and cat populations in Canada. We move down the list, we have mandatory or voluntary reporting, which again, on the livestock side, we should be fairly comfortable with this, with our foreign animal disease reporting, right from a mandatory perspective. If there is a sense that an animal might have a foreign animal disease, as veterinarians required to report that to the CFIA. But there is also laboratory reporting. So in certain provinces or for certain diseases, if the laboratory diagnoses a certain condition, that may be reported, again, either to a province where that's a requirement or federally if that's a requirement. An example that might come up would be some provinces require the reporting of salmonellosis cases. So that's even from an animal, a pet dog or pet cat that diagnosed with salmonella might then be reported into the system if it goes through a laboratory for testing. And the last one on the bottom would be sort of special sources of data. In this day and age where everything is available on the internet, if you are not familiar, ProMed is a list service. You can email subscribe to it or just go on the website and read about different disease events that are occurring around the world. And so it gives a sense of where things are happening and if there's strange and unusual stuff. This would be one of the locations where the first evidence of there being some sort of respiratory condition, both the original SARS and the new SARS-CoV were coming out on ProMed. But the bottom one would be one that has already been mentioned, CZ, and I'll just move to the next slide. So if it's something you're not familiar with, this is it's a virtual multidisciplinary network. And it's developed to support Canada's animal early warning, preparedness, and response capabilities to both emerging and zoonotic diseases. And in essence, they use a lot of information that comes in from a variety of sources to create these things called intelligence reports. And so they're essentially assessing the quality and the quantity of the information that's coming in and then suggesting what that means from a risk perspective for Canada. It's a program that people can become involved with and be one of those participants in the network, but you can also just be a user of the data. And so again, it's just a way of assessing risks over time. There's a lot of strategies that we can talk about, sort of the ones on the right-hand side of the screen there, periodic population, laboratory, event-based, kind of already covered those as some of the examples to date. But then on the right-hand side, there's some other ones which people might be more familiar with some of these terms. because you'll hear them and see them in a lot of different places. But they can be useful by themselves or in combination. You don't have to pick just one strategy. You can have multiple strategies in terms of defining a surveillance program that meets the needs, what information you need to collect, and how you need to act on it. So sentinel surveillance. Again, people might be familiar with the idea of canary in a coal mine. Right, we use some sort of indicator to give us reference for what might the risk be for all in that population. So we can have smaller groups of individuals, maybe specific locations, specific points in time to determine what is the risk of a disease, pathogen, toxin, whatever it might be, that could be affecting the rest of that overall animal population from which that sentinel group comes from. So sentinel herds, from a disease perspective, we might test certain herds to get a sense of what the total population could be represented as. Another one that's gaining a little bit more, particularly in this day and age of so much access to media and mobile phones and computers, the average person might actually become involved in disease surveillance. So this is often termed citizen science or participatory surveillance. It's the idea that you collect the data by directly involving the population that is at risk by using some pretty innovative surveillance tools. So mobile phone apps is a great one. But certainly also the FDA hotline, the online reporting system would be another sort of mechanism, right? We're drawing in the population that owns the animals or takes their animals to a veterinarian to be part of collecting the information. Always good examples in our current pandemic. If we think about the COVID reporting apps, right? If you had your mobile phone, you could upload if you were a disease positive individual and try to reach all the others who are on that network. A similar example that I have here from Tanzania. So the AFIA data, it's an interesting program to look at, but having been in Africa, especially in the Ngorongoro crater, one of the regions in which this is being done in, everyone had a cell phone. And so using those cell phones to collect the information and sort of disseminate it out to the stakeholders that needed it, right? You were using the citizens to collect it, but it ended up being used for disease management perspective. There's a lot of work looking at veterinary clinic data, be part of the surveillance I'm working on, but some people will do it from a different perspective, and that is using electronic data mining. So as we move from a paper-based, when I was first a veterinarian out in practice many, many years ago, you wrote everything down on a piece of paper and it got shoved in a file cabinet. But nowadays we're moving more and more towards the idea of having electronic records. And so if we can, centrally collect the veterinary clinic data and then mine that for what's going on from a disease perspective. How are people using or prescribing antibiotics? And so there are a couple of those programs around the world. SAVSnet is the one in the United Kingdom, and VetCompass is the one in Australia. And there are different groups that have tried it over time. I know Banfield in the US tried it, a program using that for a period of time, but it didn't maintain itself. It is quite intensive and can be a lot of work. Even though it's electronic and it's probably easy to get it in, it's still, you have to actually mine the information and get it out there. But certainly another mechanism for surveillance. And perhaps quite a useful one on a small animal companion animal side. And we have syndromic surveillance. So certainly this will get talked about a little bit if you look at the Ontario Animal Health Network, particularly their companion animal network. So the collection of information from veterinarians about their clinical impressions. So, are they having an increase or a decrease in the acute respiratory infections? Do they see more GI issues or less GI issues than maybe they saw same time last year? So using syndromes instead of specific pathogens to see what's going on in the population. But all of those, no matter how you collect the information, it has to then be translated somehow for the end user. A lot of times just taking that data and shoving it back out there without making some sort of message around it, you may not get nearly the usefulness from an action perspective. So dissemination, we can just sort of throw the information back out there. People can use it as they want. But probably the better mechanism is to actually translate that into some sort of effective messaging that then can be used to inform, influence, motivate, instruct, or even persuade people to make changes or differences in what they do. So this could be giving the information back to veterinarians who can then change a process or a policy that they have instituted in their clinic. It could be giving it back to animal owners who can then make behavioral changes for their animals. So if you were to have information that there's an increased number of disease events, that might result in a clinic introducing new vaccines that could target those. Or it might influence animal health owners, dog owners, particularly in some of the research I'm looking at, to make changes in maybe what activities they're involved in or where they go with their animals. So certainly communication is a huge component of making sure that information results in action. So certainly we've already heard that the companion animal health surveillance system is starting this idea of a companion animal health network. Certainly been great to be able to in on those phone calls and start thinking about the conversation of, how does that look from a cross Canada perspective? What are the regional interests? How are things being done in one program versus another? And how might that sort of all fit together? Certainly that we don't have the overarching ministries of agriculture that might be helping us to sort of formulate that. So it is a much broader context in terms of who are the stakeholders and how does that all work together. So I certainly applaud Doris and Teresa for helping bring that into fruition. Certainly has been some great conversations. So now I'll just transition a little and talk about the Western Canadian Companion Animal Surveillance Initiative that I am sort of the lead for. This is a program, an initiative that really is only going to work if veterinarians want to get involved. And so right now we are in the process of enrolling veterinary clinics. It's designed to be Western Canadian, so BC, Alberta, Saskatchewan, Manitoba. Any clinic that sees companion animals is certainly eligible to participate. It is completely voluntary, which you will see a lot of when you look at from a surveillance perspective. A lot of things are, voluntary versus mandatory. Do you use the carrot or the stick as to what kind of information you're going to get and what kind of buy-in. How we're situated within the the Western Canadian Animal Health Network website. It is a login website for veterinarians to get involved. So you log into the website after having registered with them. And then go to the companion animal site. And to start with, we ask clinics to do a demographic survey. So we have a sense of what how many dogs does the clinic see and where is it located. Then what we ask for clinics is that they want to participate in these quarterly surveys. So every 3 months, we put out a survey It's meant to be a very short survey, not something that takes more than 10, 15 minutes. You know, if you had to fill in every box, but most people could probably fill it in 5 minutes or less. It's designed to ask some disease-specific information, as well as some testing-specific information, which I'll show some screenshots of in a minute. And essentially, it's there so that we can look at trends over time. Are there things that are occurring more commonly in one province versus another? Are there things that weren't there previously and now we're starting to see them? It's certainly open to changes over time, but we want to be very consistent. So we're trying to particularly focus on a specific set of diseases that were identified through sort of a ranking process. Certainly, I provided at the end of the talk a place to get more information, or you can email me or ask me questions specifically. So how did we come to the set of pathogens of particular interest? One side is that we wanted to select a few pathogens that were of public health importance. And then the other set of pathogens are those that are very dog specific. So in doing that, I had a graduate student who sort of looked at, through the literature, what dog pathogens exist, and of those, how many should we be interested from a Canadian perspective, where the dog might be involved in transmission, detection, or maintenance of that pathogen, so that we can use dog-specific information about these diseases to help us from a public health perspective. And so we got down to a smaller subset of pathogens, a short list, and then we used veterinarians in private practice through another survey to help us rank those from, we can't look at all 51 or 84, I guess was on the list, but 54 groups of pathogens. So we wanted to be able to narrow that down to what were the top 5. So in that ranking process, we came up with these 5 of most importance: Echinococcus, MRSA, as well as MRSP, sort of the antibiotic resistance bacterial section, Salmonella enterica, the GI pathogens, and Borrelia burgdorferi, the Lyme disease pathogen, which would be sort of vector-borne diseases. In the top 10, there was a couple other GI and vector-borne, so we didn't want to sort of exclude them out. And so really our finalist came down to the Echinococcus, GI pathogens, the antibiotic resistance pathogens there, and the vector-borne pathogens. So those were our public health importance, but then we also asked questions of people, sort of what was their companion animal ones that were specific to dogs that they would also find interesting, to make sure that we didn't exclude anything that veterinarians could find very important for their private practice as well. If you are interested, some of this was written up in the Canadian Veterinary Journal. As well, in sort of our deciding, are these the best pathogens to look at? We did another survey just to make sure that, practitioners were actually diagnosing any of these pathogens. And we focused in on Alberta, Saskatchewan, Manitoba for this survey. We had 60 participants who we asked basically if they had diagnosed any one of the pathogens of interest at least once in a dog in the past 5 years. And the table that came up is the one there on the right-hand side of the screen. Certainly the idea that we did have all of these pathogens, at least a number of clinics were diagnosing them. Some of them were regionally specific. So Borrelia burgdorferi, most commonly in Manitoba. Echinococcus was most commonly being diagnosed on Alberta. But a surprise to me was the 2 on the bottom, Ehrlichia and Anaplasma. I was quite surprised at the number of clinics that were reporting these pathogens. I might have expected a few, but I wasn't quite expecting nearly the same number as were diagnosing Lyme pathogens. So that was quite interesting. But certainly it gave us the sense that we were on the right track for these are important pathogens to look at. In terms of a surveillance system, you always want to make sure it's consistent, systematic collection. And so we created some case definitions. So when people go onto the website to do the quarterly surveys, they know what it is we're asking them to report about. So for the quarterly survey itself, this would be an example of the question that we're looking at. So for echinococcus, during the previous 3 months, so this is the survey that some of our enrolled practices are doing presently. So for the previous 3-month time period, did you diagnose at least one case of echinococcus? If it's no, you'd move on to the next. If it's yes, the question would be then how many cases were reported during that quarter? And is that similar to the same time a year ago, either increasing, decreasing, or the same? So it's a pretty simplistic question. You can probably fill it in pretty quickly, particularly if you haven't seen any of those pathogens, it would go pretty fast. Additionally, subsequent question is asking a little bit about testing. And the reason for this is that as we were asking veterinarians how they were diagnosing things, for the vector-borne diseases, 70% or more were using in-house 4DX SNAP tests, and they may not have actually been reporting that anywhere. So another piece of surveillance that's sitting and existing in veterinary clinics, but not being captured anywhere else. Similarly, with fecal flotation, we found that about 75% of clinics were also doing their own in-house fecal flotation and may or may not be reporting that anywhere either. So wanted to sort of capture some of that baseline information of what kind of testing is being done. So those are the types of information. And essentially then, right, there is that information needs to go somewhere. And so the idea of creating reports that then can be shared with stakeholders. So the idea of sharing it, for the public health important ones with public health stakeholders, but the animal health important ones also need to get back to the veterinarians. And so that can be through the website, the login, or perhaps sending it through the VMAs and the newsletters that are available. So we're still sort of looking at best ways for communication, and we'll be exploring that throughout the remainder of the surveillance project itself. So I think that gives sort of a sense of, what is surveillance? I'm hoping it gave a sense for individuals why it might be important. We certainly on the large animal side, I think people recognize and have experience with using surveillance information and being part of collecting that. But it hasn't necessarily been entrenched as much on the companion animal side. And my hope is that, getting more people to talk about it. I talk about it with the students in the class when I teach at the vet school. It's really just getting people more familiar and more accustomed to the idea of what it can provide for them, as well as how they can be a part of that. So I think that kind of takes me to the end of that piece. I'm sure there'll be time for questions later, but I'll send it back to Teresa.
Thanks, Tasha. That was great. It's a lot of detailed stuff to cover. I think you did an excellent job. I'm always trying to figure out how to make surveillance sound exciting, and it's always a little bit of a challenge. So next we're going to go to a round table, but first we just have a little poll for everyone. We wanted to collect a little bit of information about who's here today and what their interests are. And then while we're doing that poll, Andrea Osborne, who's the CZ coordinator, and Doris Leung, who's our CAS communications leader, are going to post some interesting links in the chat for you. And if anybody else has any interesting links, feel free to post them in the chat. And that way people will have those resources to go to at the end of the talk when they have a minute. So I think we're going to post ETIC. We have a new COVID in animals dashboard that the CFIA is we're hosting on behalf of the CFIA on our website. And then Andrea, I think, has some CZ links she might post. So please feel free to check out the chat. And Doris, are you ready to launch the poll?
Yeah, if you want me to do it.
Yeah, could you?
Okay. Can you see the first question?
Yes.
Okay, I'll read it out too, just in case you can't see it. So we just wanted to get a sense of, who's part of our webinar today. So we have a few vets and vet techs. We'll give everyone a few more, maybe one more minute for this question.
And then in general, we're going to go to our roundtable, and then we'll have Q&A session after the roundtable. So don't worry, you will get a chance to ask questions soon, just not quite yet.
All right, we've got 45 people answering. I'm going to end this poll. Okay, about less than half that are vets and a few that are vet techs. We have a few other and one pet owner. So quite a variety of participants. I'm going to launch a second question. Which region do you work in? Okay. Looks like mostly in Alberta and Ontario, and a few from BC and a few others from Yukon and Manitoba. Okay, so I'm going to stop sharing that. Go ahead, Teresa, with the key panelist intro.
Great, thanks. So looking forward to this part of the webinar today. This is where we get to hear from all the different regions of Canada to find out what's going on there. And so what we're going to ask our panelists to talk about is, how's it going in your region in terms of companion animal health surveillance? What's on your radar? So what's interesting or on your radar to pay attention to? And do you have a wish list, either from the veterinarians on the call or a more general wish list of what you would like to see sort of enhance in terms of companion animal health surveillance in your region? So today, I'm really excited. We really have a nice full panel from across Canada, and I'm going to start with Dr. Mary Vanderkop, who's the CVO of Yukon. So she's joining us from north today. And then I'm going to go out east because they're working later than anyone else. So Dr. Nicole Wanamaker is the CVO of New Brunswick, and she's joining us on the call today. So the Chief Veterinary Officer for New Brunswick. And then heading a little bit east of that, we have Dr. Maureen Anderson, who works at OMAFRA, as well as does a lot of work to support the OWEN Companion Animal Network, as well as the public health work that OWEN does. And then moving west from there, we have Dr. Dale Duma, who's the public health veterinarian at Manitoba Agriculture, or the CVO office for Manitoba. And then going on into Alberta, we have Dr. Hussein Keshwani, who's the public health veterinarian from Alberta Agriculture. And then I'm just making sure I didn't miss anybody in my geographic journey. And then I think we go nationally, and that's Dr. Joanne Tataryn, who is the public health, an epidemiologist at the Public Health Agency of Canada. Did I miss anybody from our list, Doris? I think I got everybody there. Yeah, okay, good. So I just wanted to thank all the panelists for being here today and for being willing to spend their afternoon or evening talking about companion animal health surveillance. So if Mary, Dr. Vanderkop, are you able to go first? So again, the questions are, how's it going? What's on your radar? And do you have any wish list?
Okay, in terms of how it's going in the north, I think we're a little bit different from other jurisdictions, and I listened with interest to the descriptions of companion animal health surveillance and the type of approach that can be taken in the larger jurisdictions where you can engage multiple veterinary practices. And we really have very few, and we really have very little opportunity to work through practitioners to gather the quantities of information that might be desirable. I find it interesting to note the sort of definition of surveillance as information for action, and as a government role, we're almost always taking action without information. We are compelled to implement programs and do things based on demands, and often we're gathering information to refine what that action is or to build on that. And we have a pretty limited scope and responsibility for companion animal disease. The overlap with public health makes rabies the key concern, but the investment that we're able to implement in surveillance for rabies in wildlife it's really pretty limited. You know, that even if we look at a vast number of submissions, they're not necessarily targeted and they're not necessarily representative of what the risk might be. So we actually are, if we're doing surveillance on anything, it's more indirect in that we're doing surveillance for the risk associated with that. So we have the opportunity to look at dog bites or animal encounters and gather information on that as a result of a program that we put in place, right? We took the action first, then we do the surveillance after the fact to hopefully refine that program as we go along. The other aspect I think is interesting from the Northern perspective is that our surveillance around companion animals is focused to a large extent on animal welfare and on concerns about animals and the human interaction. And in working with folks in communities, in small communities with tremendous amount of history, we don't operate from a perspective of issuing questionnaires and gathering data on diagnostic testing. The majority of when we're engaged in that, our surveillance is about listening, and listening on a repeated and ongoing basis to the people and the knowledge that's accumulated in those communities with respect to the things that are of concern to them. So I guess in summary, I think we take a little bit of a different approach to companion animal health surveillance. And in fact, we do wildlife surveillance and we do domestic animal surveillance to a limited extent. We take a little bit of a different approach to it here. What we wish we had more of, always it's resources. But I think at the same time, we do actually quite a good job with what we have. And we try to capitalize on the interest from the folks that we deal with on that ongoing basis to use the surveillance, not only to modify our actions, but actually to support decisions, because ultimately that's where we end up in these situations, is to be able to justify and support a decision, whether that's with respect to action, whether it's with respect to stopping actions, whether it's with respect to developing and implementing policies or programs. So that pretty much summarizes my perspective on companion animal health surveillance for the Yukon.
I think that is a fantastic start. Thank you for going first. We are getting some good questions in the chat, and I think some of them applied quite specifically to the north. But we're going to hold the questions till the end, and then we'll have a chance to go through them all. And from our perspective, there's no rush for us. So if we do go a little bit over, we'll keep the Zoom open. So Dr. Nicole Wanamaker, are you there? And are you able to tell us about Atlantic Canada?
I am. And I'm sad on your poll that there was no, sorry, there, that should be better. I was sad on your poll that there was nobody from Atlantic Canada showing up. So
I was sad too. I was like, oh no, poor Nicole.
That's okay. So I guess I'm the spokesperson. Somehow I got voluntold to be the spokesperson for AtCan. And we're fairly new. We meet quarterly by Zoom, and it's all for Atlantic provinces. And how's it going for us? It's going all right. We meet quarterly, and mainly it's about lab information that we're exchanging right now. And so I was trying to figure out on the companion animal side. We do look at wildlife, we do look at livestock diseases and companion animals, but like I said, it's all at the laboratory level. It's not at the clinic or practical veterinary level for a practitioner practicing. In saying that, though, the livestock diseases are looked at as a practical point of view because of government. And for example, the Newfoundland and New Brunswick have a provincial veterinary service. So they would be looking at that information quite closely. One thing that I wanted to put on the radar tonight, and maybe this is for all veterinarians across Canada, just because we're seeing it here in New Brunswick, is maybe making small animal practitioners aware of the provincial animal health acts that are out there for reportable or notifiable provincial diseases. I know in New Brunswick here, we have some small animal practitioners that look at chickens and pigs and bees. And we have some diseases in a provincial list that are associated with those species. And so it's just making everybody aware about those diseases that are on a provincial list that may need some action. So that was just something that I was thinking about tonight in talking, that it might be important. Other than that, our wish list, I guess, for the Atlantic provinces might be looking at tonight's platform and maybe starting a small animal network here. I have talked to a few practitioners who deal with small animal, thought it was a great idea, but it's to find the time. That's the only thing to do it. And there is some interest in it. And it's just, like I said, matter of finding time. As Dr. Epp said, it's time consuming to gather data and to translate that data into something that's important, and then passing on that information to the right people. So I guess that's about it for the Atlantic provinces. And just a reminder to avian flu is out here and it's not fun to deal with. So we don't have it in New Brunswick yet, but it's all around us. But anyways, just something to watch for. Thank you.
Thanks, Nicole. Okay, moving on to Ontario. Dr. Maureen Anderson, are you there?
I am, and I actually went so far as to put together a few little slides, so you don't need to look at me
Okay.
when I'm talking. So in terms of, I didn't get the list of 3 questions before I did this, but I think the slides will answer 2 of them, and then I can come up with a wish list at the end. Anyways, I'm updating on the Ontario Animal Health Network. We are actually I believe the oldest companion animal network in Canada of this kind, but Owen's very similarly organized to CAS in that we are a network of networks. We started in 2013. Again, our goal is, Tasha very well showed, is we're doing surveillance, we're looking for trends, and then we're trying to communicate that back out to Ontario practitioners, be they companion animal in our case, or any of the other species networks. And the way our networks are organized, we have a core team, and this is the team that actually meets every quarter or every 6 months or so, depending on which network you're in, and actually talks about the data that we collect and figures out, what needs to be communicated out and what's important to practitioners and that sort of thing. So we have an OMAFRA co-lead, which for companion animal is myself, and then we have practitioners or industry representatives, and then we have folks from the lab, folks from the teaching hospital who are species specialists, some epidemiology support, and our own network coordinator, of course. And so what we do, again, it's a lot of what Tasha already said. We're watching for trends. We do a clinical impression survey, and we do that sort of syndromic surveillance every 3 months. And our survey is designed to be done in 5 minutes or less, unless, like Tasha said, if you have to answer every single question that yes, there's something going on. We do monitor the laboratory data that we can get our hands on, but we get a lot more information from our clinical impressions. And we've also created what's effectively an anytime online disease reporting portal. So if somebody sees something that's weird or unusual and they want to report it to Owen and let us know about it, and a lot of some diseases, again, like leishmania, I saw somebody mention in the chat, right? That's not a notifiable disease in Ontario, but veterinarians sometimes feel like, I want to report this to somebody. So Owen gives them that opportunity, and our portal lets them do it anytime. They don't actually have to wait for the survey to let us know that there's something going on. And then again, our goal is to keep veterinarians informed. What are we hearing? We report that back to them. We sort of filter it out to the most important stuff, provide them with additional resources if we're getting lots of questions about Ehrlichia or Echinococcus or something like that. We try to provide them with resources so that they're informed. And we refer to them as our seasonal N2K or need to know update. And that's our veterinary update that we put out. And then we also do a lot of resources. So we work on infographics and info sheets. We do podcasts. We just updated our Canadian antiparasitics table for anybody who's interested. That's always a very popular resource. So updated for 2022. It basically lists all of the antiparasitics available in Canada and what they're labeled for. And just to shameless plug, here's some of our resources. These are some of our infographics we did on antimicrobial stewardship, which I'll link back to the ISCAID antimicrobial use guidelines, which of course are really valuable resources. One of our infectious disease infographics on Echinococcus, there's the antiparasitics table. We also do a public health update to keep us connected to our public health colleagues. And we basically, what that is we take our last 4 updates through the year and pull out all of the sort of bits and pieces that would be relevant and most pertinent to the public health units and public health inspectors. And we put that together in an issue just for them. And that's actually really well received and very much appreciated by the public health folks who get that as well, because it keeps them connected to what's happening on the animal health and companion animal side. Info sheets, we helped sponsor the update of the infection prevention and control best practices for small animal clinics, which was a really big project for us. And then our latest update, what's going on right now in Ontario, our latest update came out at the end of January. We're still monitoring canine infectious respiratory disease in Ontario. No particular pathogens have cropped up, but we continue to hear about, outbreaks here and there and increased disease. We've had a cluster of Paragonymous pop up in the province, which is a little bit unusual, and we're keeping an eye on that and hopefully aiming to come up with some resources for veterinarians regarding that, because it's not a parasite that everybody deals with every day. We always recap our rabies situation in Ontario, because that's always very important. And we covered an interesting outbreak of blastomycosis that occurred in one of our northern communities in Constance Lake First Nation, which we had a large outbreak of blastomycosis in people. And of course, people got worried about, animals and their dogs and so on and so forth. So we made an info sheet for that. And of course, we're promoting the first line app for the CBMA AMU guidelines. So, and there was other stuff in there too. And you're welcome to go and read it if you would like. One other thing we do, like Tasha said, surveillance is information for action. So one of the things we sometimes do is when we get some information, we take action by then going and doing the research. And we do have some limited research dollars available through Owen, which we're really fortunate to have. But these are to do very short-term projects. So help fill gaps and time-sensitive needs that we can't necessarily get other research projects going for. The topics are proposed to and selected by the network. Some of the projects we've done are, we co-funded the Echinococcus multilocularis prevalence study in wild canids in Ontario, Brucella canis, again, surveillance in Ontario and in breeding kennels. Most recently, we did a SARS-CoV-2 seroprevalence study in pets in positive households. And we are still working on and hopefully wrapping up our pathogens in imported dogs from Asia study, which got a little bit sidebarred by the whole COVID thing, of course, but we're hoping to finish that one up and move on to some other projects as well. And of course, all of the project summaries are available on the Owen website. If you want to sign up, if you're from Ontario, short version of this slide is go to the owen.ca or go to owen.ca and you can get signed up, and we will not spam you, I promise. We will send you the survey and we will send you the report. And you can opt in or out of whatever you'd like, but even if you're not part of the OWIN network, I encourage you to go to the website, check out our resources and all that sort of stuff. And in terms of a wish list, the one thing we're always wishing for in terms of OWIN is more participation on our surveys, right? We have several thousand small animal veterinarians in Ontario. You know, we're lucky if we get triple digits on our survey responses, but the more people participate, the better the information that we have, and the more we can do for Ontario practitioners. So trying to get more people to participate is what we're always aiming for. I'm really looking forward to having other companion animal networks that we can share resources with. So, you know, we don't want people to reinvent the wheel. We'd love to share our resources further across the country. And if others are developing similar resources, then we can share them, and it helps keep everybody better informed and up to date. And again, give something back to the practitioners who are giving us the information on their surveys, right? So they actually get something in return for their 5 minutes every 3 months to fill out our survey. I'm looking forward to being able to compare Ontario to something, anyone in another part of the country. I think would be really interesting, because we've been the lone companion animal network for a little while, which is kind of cool, but at the same time, be neat to compare with others. So how's that?
That was great. Thanks, Maureen. I didn't want to give you the questions ahead of time. That wouldn't have been very fun. So next we're moving on to Dr. Dale Duma from Manitoba. Dale, are you there?
I am.
Hi.
I also thought you wanted a presentation, so you're going to get one. Let's see here. See if that worked. Can you see that?
Yep.
Perfect. So similar to what's already been said, other than Ontario that actually has a companion animal network, we really don't in Manitoba. I would honestly say we don't really have a companion animal surveillance system at all in Manitoba. What we have is a few different segments that kind of relate to surveillance, but certainly don't have kind of that structured ongoing program that would be awfully nice to have. Part of the reason is because reportable diseases here, as elsewhere, are really not focused on companion animals. So you look at this Manitoba list, tularemia shows up, you could kind of lean towards companion animals there. But beyond that, it's really animal agriculture, food production, and that's what our Animal Diseases Act is focused on. If you look at our Public Health Act, it's very similar. We do have this little section of our Manitoba Public Health Act that includes zoonotic diseases, where if we identify them in an animal, we do have to report them to the public health system. But by far the most engaged aspect of what we do looks at emerging issues or public health issues that are not necessarily reportable, but do have a veterinary component. And so with our One Health program, we are fairly engaged with our counterparts and work more of in a responsive manner than in a cohesive surveillance system. So really One Health is what drives our companion animal work. If it doesn't relate to One Health, we really don't do it. Usually that means public health, but occasionally it might have some emerging health issues, climate change type related issues that generate broader interest. Tick-borne disease typically is one of the more looked at programs. And then we also have our actual regulatory response programs like rabies. People will refer to that as surveillance, but really it isn't. It's very much a response to a public health event. And if we wanted a true surveillance program, I think we would have to do a fair bit of fleshing that program out to be able to speak in a representative manner. But it does provide us a fair bit of information, as I'll show you some data in a minute. Things like Brucella canis have gotten some more attention as of late, Echinococcus, Blastomycosis, and that's really because of the human health aspect, specifically Blasto and Echinococcus. It's been in response to human health cases, and then the public health system wanting a context to put around a human that's suffering from one of these diseases. or is concerned about a disease. Our Brucella canis case was one of our imported cases and happened to be owned by somebody with immunodeficient issues. So not an ideal situation, but public health asked us to engage on it, and so we've been providing support in that case. And then occasionally we get these kind of weird and wonderful specific interests from a remote community that's dealing with an animal health issue. Usually it's something like distemper or parvo. It's not a surveillance effort. It's just occasionally we get dragged into a response. We don't gather data in a manner that you can really interpret at a broader level. So to call it surveillance would be a gross overstatement. When we're talking about tick-borne disease in companion animals, we're really looking at our laboratory data, and we don't have a lot of it. So here, I mean, the 4DX snap tests are the most common things used even within our lab system. And 2021, we had 145 samples. So, I mean, that is not a lot of samples when you're talking about a provincial level program. As you can see, we did have a few positive results on that 4DX. We never have identified it through PCR, but if you look at this data, we haven't run very many samples either. So to interpret that would be somewhat suspect. But certainly we have lots of Lyme disease in Manitoba. We see it in humans all the time. We know it can cross over into dogs, and a lot of our veterinarians report seeing it on a regular basis. We also look at the anaplasma, the human strains of it. So obviously also the dog strains, but because of the human concern, that's really why we get asked to look into stuff like this. Again, if we look at our 145 samples, we get a few positives on the SNAP test. In this, we actually do see it on PCR, so we're a little bit more confident that it's really circulating in some of these animals. As opposed to Lyme disease, we don't have a lot of that data. One of the things we have looked at is the veterinary perspective. So this is a bit more on the soft data side. We were asking our veterinarians in Manitoba what they see, how they feel about it, some of their treatment practices. Again, this is a survey, it's a one-time snapshot. It's not an ongoing evaluation, but it does provide some interesting information. Certainly, we see a fair bit of the Lyme disease, or the veterinarians in Manitoba think they see a lot of Lyme disease. When you talk to them, a lot of them equate a positive SNAP test with a case. Brings up the whole question of what is a case definition for some of these diseases, because certainly a lot of these animals are not clinical, have no actual history of exposure, but are flagging positive on a serologic test. Then a lot of the vets are treating it and not seeing clinical disease, and therefore claim successful treatment. So it's a bit of an interesting situation. You don't want to chastise them too much, but at the same time, you got to question what you're hearing at times. This vet perspective survey was not specific to companion animals. So you see like Anaplasma marginale here, that's obviously ruminant specific. But the Phagocytophilum, you see a little bit of the Babesia, Rickettsia, and then Ehrlichia as well. We do have some, especially in Lyme, some clinics say they see cases all the time. Again, when you ask a few more questions, I'm not so certain that they're really seeing true cases, but we shall see. One of the questions we asked when we were doing this survey was assessing their comfort level on certain diseases. So as you can see here, they're very comfortable with Lyme disease. They're comfortable in their ability to diagnose it and treat it. Most of them are pretty confident in the vaccine effectiveness. Approximately 60% push the Lyme vaccine in dogs. Depending on who you talk to, whether or not it's actually effective, seems to be about a 50-50 split out there. But it gets used a fair bit in Manitoba just because we have a lot of Lyme. Then when asking about treatment success, our vets are very good at treating tick-borne disease. That's what I'll say based on their self-perceptions. This is not based on any diagnostic support, so whether or not any actual pathogen was cleared through their treatment or any clinical signs were resolved, that is far more questionable, but it's interesting to see how comfortable they are, how they feel at least when they're treating tick-borne disease. And as you see, it's almost entirely doxycycline that gets used regardless of the pathogen. So that's the tick-borne stuff. This is an example of one of our responses to a human case. So we had some human Multilocularis cases, and that got the public health system asking questions like, well, what's happening in the animal world? And we really had no clue. We did a little bit of a survey with our public health counterparts. If you look here, not a lot of samples from domestic dogs. We had 44 samples. We did find one, canadensis, no Multilocularis, which was not a huge surprise, especially with only 44 samples. When we looked at some of the wild species, we saw a much higher rate. So, I mean, depending on, most of them are coyotes. So 7% positivity for Multilocularis, 6% for canadensis, which is fairly consistent with previous reports in the area. But there's not a lot of surveillance data or survey data out there on these parasites. So we try and take opportunities to do studies like this when we can with our public health counterparts. And then hopefully over time, we can do more of these and build it into a trend line. But at this point, it's really single snapshots. The other thing we do look at is some of our regulatory control programs. So rabies being kind of the main one that people think about. Obviously, rabies affects more than companion animals. In Manitoba, the vast majority of samples come from companion animals, but most of the cases do not. So if you look at our rates here, obviously skunks drive our rabies program, or drive the rabies outbreaks in Manitoba. But these are not representative. These are very specifically sampled from either a human exposure or a domestic animal exposure that would lead to some kind of treatment response. If it doesn't, we won't sample it. So there's a lot of samples out there that are likely rabies positive that we don't capture because it's purely a response program. But still, it does provide us some feel for how our rabies rates are affected over time. This past year was by far our highest percentage of positivity that we had had since taking the program over in 2014. We also look at our variant strain when it comes to rabies. So interestingly enough, our dog and cat positive cases did have variants that weren't Western skunk. In Manitoba, almost everything is Western skunk. But we did have a cat that was a bat variant, and we had a dog up in Churchill, which isn't too surprising. That was an Arctic fox variant. And as far as future interests or collaborations, I think we'll, as a public entity, we'll stay focused on the emerging issues. It's pretty hard to justify putting the resources towards purely kind of animal interest if it's not either a public health priority or an emerging disease priority. Having said that, if there's enough interest out in the veterinary world or in the public, certainly we'd be interested in participating and collaborating. Probably not as quick to fund those kind of initiatives though. Antimicrobial use and resistance are kind of one of those issues that continues to float as a priority, but hasn't really taken off yet on a surveillance or even a data collection piece as of yet. We are talking about updating our reportable disease lists, and I think having at least a One Health lens looking at companion animals is important as provinces and territories move through those processes. But I'm under no delusions that they're going to take a major role. It's going to remain egg-centric, I would say. But I do think there is a place for increasing our engagement on some of these companion animal issues. And so for now, I think I will leave it there.
Thanks, Dale. That's great. Lots of information in those slides. So now we have two more presenters. We have Hussein Keshwani, Dr. Hussein Keshwani from Alberta. And then I think we're going to wrap it up with Dr. Joanne Tataryn doing a brief update from PHAC. So Hussein, are you there? Are you ready to go?
I am, yep. Can you hear me okay?
We can hear you well. Oh, there you are. Hi.
Great. Yeah, so nothing so well developed as what Maureen and Dale have presented. So I'll be a little more brief about what we're up to in Alberta. We have essentially nothing that I think you could truly call an active surveillance program related to companion animal health. I think probably the closest we come would be the tick surveillance program, but really that's more on the vector part of it. The animals themselves would be more passive surveillance in terms of Lyme. Lyme is a notifiable disease in all animals. The tick surveillance previously was provided through Alberta Agriculture. So we had a system for clinics to be able to submit easily to us for ID and then testing of appropriate ticks. And that was transitioned over the last year and some, transitioned over to eTick. So we're now using the eTick platform, and it's more integrated with our public health laboratory who's overseeing that program. So we get some good data out of that. And the other one that comes closer to surveillance would be the rabies work. We have active surveillance in skunks and striped skunks along our southern and eastern borders. We do have active surveillance, although sample numbers, we don't necessarily have a huge degree of confidence based on the sample numbers have dwindled over time just because of the cost involved in getting that. And then we get, whether we want to call it passive surveillance or otherwise, just out of testing any symptomatic domestic animals. And most of that, as Dale pointed out, comes out really from a response to some sort of exposure. We do also, we're a little bit more permissive maybe in Alberta. If we have symptomatic wild or domestic animals, we do try and get those tested just to provide a little bit of passive surveillance data. But that's about as far as we go. So most of what we're doing is really passive in terms of salmonella. All serotypes are notifiable in our companion animals. And those would be the main ones. We do hear about other things, and I think it's kind of an indication of the things that people think should be notifiable or reportable. So things like Brucella canis, Echinococcus, especially if they have animals with, the alveolar disease. We worked with Alberta Health Services last year around trying to report possible instances of blue-green algae that might have been involved in animal disease. So similar to what Dale was saying, it's really more around the public health or the One Health sort of lens. These things that have some importance to human health tend to get more attention. One of the others we actually don't hear much about, but there may be value in maybe more of a discussion around is toxin ingestion. So toxins like lead are reportable in food animal species for obvious reasons, but we don't have anything that would be reportable in companion animals. And there have been some case examples, at least in other jurisdictions, where if certain novel toxins were reportable in companion animals, there may have been an opportunity to respond a little quicker than what happened to be the case. So some situations involving like copper toxicity from novel products that weren't necessarily suspected, but in time of being discovered to be more of a problem. So in terms of what I'd like to see going forward, one of them is perhaps just as much of a me problem as it is a provincial problem, and that's a little bit better integration between provincial government and our various academic institutions. So we're still developing those relationships between ourselves at the provincial government and the UCVM, the U of A, and King's College. We have a lot of one-off projects, and I sometimes I hear about new things going on that I wasn't aware of. So I'm obviously I've been in this role just for a little over a year, and so I'm still making some of those contacts. And so I'd like to see that continue to develop because we're finding more opportunities to collaborate. For instance, around Echinococcus, we've got some work developing a provincial assay to detect the European genotype. So we've managed to work with our UCVM colleagues to get animal samples to start to validate this assay and learn a little bit more about what we're seeing in animals in terms of specific genotype compared to humans. And the reason I mentioned that one specifically, Alberta is a bit of a hot spot right now. at least in terms of the attention it's getting for echinococcus in humans, because we have, I think we're up to 22 human cases of alveolar disease. So that one's getting increased attention. I'd also like to see our participation in tick surveillance go back to where it was. So under the provincial program, under Alberta Agriculture, practices knew where to send their samples. And when we shifted to e-tick, especially during COVID, there was a little bit of an upset to the system. And so our sample numbers last year were really low. Some of that was probably confusion. Some of that might have been that ticks were actually lower last year just based on the weather. So I'd like to see participation go back up in the tick surveillance program. I'm interested in some of what was being said around surveys for other diseases, because we have had some discussions about whether some of these things should be provincially notifiable, be it echinococcus or toxin ingestion, things like that, maybe those things can be surveilled through a system that's not led provincially, but I think being able to develop more learnings from what's going on in private practice would be beneficial. And the other thing, similar to what Dale mentioned around antimicrobial resistance, obviously is a priority item. We have managed in Alberta to provide some grant funding to the UCPM so we can get a little bit of increased data on AMR in food animals by subsidizing culture and sensitivity. But we don't have anything equivalent to that on the companion animal side. So it's definitely one area that accessibility to culture and sensitivity is still one of the shortfalls in gathering that sort of data. I think I will leave it there.
That's great. Thanks for that update. Okay, before we turn it over to our final roundtable panelist, which is Dr. Joanne Tataryn from the Public Health Agency of Canada, to bring it all together at the national level. I just, if you do have to go in the next minute or two, please feel free to sign off. We thank you for attending. And if you're able to stay on a bit longer, we will be following up Joanne's update with some time for questions and answers. So please stay if you can, but if you have to go, we understand. And with that, I'd like to turn it over to Dr. Joanne Tataryn from the Public Health Agency of Canada.
Great, thank you. Can you hear me okay, Teresa?
Yeah, you just came in better. We can hear you well.
Okay, great. Okay, so I guess I was asked to provide some perspectives from the Public Health Agency, so I'll try to be brief. We're running out of time here, but within the agency ourselves, much of the work connecting to our One Health partners and networks in Canada is really focused in one center. So it's the Center for Foodborne Environmental and Zoonotic Infectious Diseases. So that's where I'm located, and we cover off a lot of activities on foodborne disease, food safety policy, antimicrobial resistance and use. Our variant CJD surveillance activities are in there, along with zoonoses and our vector-borne disease surveillance programs like Lyme and West Nile and things like that. And the center is also home to a relatively new fund, the Infectious Disease and Climate Change Fund, which was really instituted to help bolster research related to infectious diseases in this area and climate change to help position us for sort of future challenges. So I would say overall, in the center, there's been a long-standing recognition of the importance of One Health work. And sort of we've always been advocating and rallying for more information on the companion animal side of things. We're very supportive of integrated surveillance initiatives. And then in the last 2 years in particular, with this massively terrible pandemic, we have seen a heightened awareness broadly amongst the public health community of the need to pay more attention in this One Health realm. So in particular, we've spent a lot of time looking at SARS-CoV-2 at the human-animal environment interface, and have been able to support a few more, I guess, research initiatives, less surveillance per se, but related to transmission to pets in households and shelter settings. So very happy to hear this work underway. We're certainly, I think we see ourselves as consumers of this information. I'm always happy to see, I didn't realize it's called OWEN, the Ontario report, and now some of these other initiatives across the country like Dr. Epp. So this helps us position to see areas of increasing public health risk, which helps to drive our policy and education initiatives. We're also participants in some of this work where it's appropriate, and then funders through the climate change solicitations and also some of the other targeted funding we receive. So we try to get the research out to our partners to move this work forward. And so the ETIC initiative I saw in the chat, as well as Dr. Epp's work, these are some of the initiatives that we've been able to support in part. So I think a lot of the what's on our radar and what's on our wish list have been mentioned. Of course, vector-borne diseases, as our climate changes, what's emerging on the forefront on the vector-borne disease side of things is of key importance. Emerging environmental diseases are starting to keep me up a little bit more at night. Things like blastomycosis, and I think there was mention of blue-green algae blooms, echinococcus, a really important one. I would love to actually see some surveillance work on dog bites, and because that's another really important public health issue that I think we struggle to understand. Along with, there's many others, I guess I won't take too much more time, but things like we find ourselves working on rodent-borne diseases, things like sole virus that we found in pet rats in Ontario a few years ago that we don't really know too much about, SARS-CoV-2, raw pet food, etc. So lots of wish lists, and again, very supportive of the work underway. I think I'll stop there because I know we're out of time.
Thanks, Joanne. Yeah, we are out of time. So thank you to everyone who was presented, Dr. Epp, and all of our panelists. If you wouldn't mind, if you're still here, giving them a reaction, and then we'll have some questions after Doris has been compiling the questions. So thank you very much. Yeah, there we go. Good.
Great, thanks. So maybe I'll just start with a few that were chatted to me during the presentation. So the first question is to Tasha. I think this is a question related to your canine pathogen of importance, public health importance. Could you please clarify for echinococcus whether the information provided related to alveolar or visceral disease, or if it's related to intestinal carriage of the adult worm?
Certainly in the surveillance, it was, they could describe a little bit more. Was it clinical? Was it just on a fecal flotation? So there was, we were trying to get a sense of what people were seeing in that initial survey. And now we're certain in the surveillance that we're doing now, we're looking at it from the perspective of a diagnosis. So if I go back and sort of look at, we have an actual case definition that we've put together. I'll just find that in terms of what we had. It was an urban, rural, or free-roaming dog with a positive fecal test or a PCR test for either Echinococcus multilocularis or granulosis, regardless of clinical signs. That's sort of the surveillance definition. But then we can ask more questions at that point about, tell us a little bit more about those cases. And we have that as a comment box after, so that people can provide if it's clinical or not clinical, and give us a little more perspective on those.
Thanks. I'll move on to the next, maybe I'll just have Ellen. I know you're raising your hand, so we'll move on to Ellen's question, and then I'll go and I have another question in the chat box, but go ahead, Ellen.
Hi, one of my questions for kind of the group is that in the ER, especially in BC, we're seeing a lot of raw diets, definitely increasing. I'm wondering now that there are some antimicrobial resistant salmonellas, if anyone has done any initiative to look at surveillance of these raw diets, and if so, has anyone found any of these antimicrobial resistant salmonellas like Salmonella Dublin in their findings?
I'll chime in for Ontario since there's a gaping silence. We don't do surveillance on the raw food diets. There have been obviously some research projects on them. I can't recall if they found any, off the top of my head, if they found any significantly multi-drug resistant salmonella in those, but we do occasionally have contact with our public health colleagues when they find multi-drug resistant salmonella and there's any sort of epidemiological link to somebody who's feeding raw food in the households and that sort of stuff. But I don't, to my knowledge, know of any published reports about that, and we're not doing active surveillance on it, but it is a good thought.
Sorry. Next question. I know Tasha answered it in the chat box, but I'll just put it out here again in case we have our panelists, if they have more of any additional comments. So, are we leveraging citizen scientists enough? This question's for Tasha, as well as especially in the north. I know, Tasha, you've kind of answered it, but just wondering if Mary or if anyone else has any comments.
I just comment that probably we aren't to the extent that we might be. Our challenge is really identifying the right questions to try to collect information on, as well as the bias that comes with relying on mechanisms like citizen science that may not reach the diversity of the population here. So we're kind of cautious about entering into those relationships and relying too much on that, because it relies to a tremendous extent on technology and familiarity with technology. And often the things that we're interested in are things that we get the most information from older people in smaller communities that have less access to that technology.
I'll just throw one other comment on there. And I think one of the challenges in a regulatory framework of using citizen science is you're typically trying to use your data to make regulatory decisions or having some kind of impact on disease control. And to support those kind of decisions, you really need some fairly validated justifications. And it can be tough to validate citizen science at a level that you can get kind of the regulatory bodies to kind of support it and feel comfortable sticking their neck out just based on that alone.
That's certainly the case here. And for much of the decision making, we're bound to mandated public engagement processes. So the citizen science, we use ETIC for collecting information on when members of the public find ticks on companion animals, because they're seen as an emerging threat here with climate change, but we would not rely on that for any decision making or policy development.
Dale and Maureen, or Mary. So the next question is for Tasha, and I think it's about the CASI initiative. What is considered a companion animal in this context?
Yeah, so to start with, we're actually focused strictly on dogs to start with. And then, you know, as things keep expanding and getting bigger, you always kind of want to start with something manageable and then sort of work up from there. The thought is to include cats next, And then possibly to start thinking about some of the exotic pets as well. And so certainly, horses could be considered companion animals, but they already have their own network on the weekend. And so there's really no sense in sort of double dipping. But we've started, this particular initiative we've started with is focusing in on dog related issues.
Great. I think we're at the end of our chatted questions. So is there anyone with any last burning questions before we wrap it up for today? You just raise your hand. All right. Well, with that, I think we'll draw this first companion animal national surveillance cross-country checkup to a close. Thank you again to all the presenters and the roundtable participants and everyone who made the time to attend today. If you want any follow-up, have questions or want to reach out to anyone and you don't know how, please feel free to reach out through Doris or I, through Cass, and we'll connect you wherever you need to be connected. We'll just chat our email in the chat box, or you can go to the CAS website and there's a contact us button.